Mississippi this week became the state with the worst number of coronavirus deaths per capita. In fact, if Mississippi were its own country, you would be second in the world only to Peru in terms of deaths per capita. That's a horrible, horrible, heartbreaking statistic. So with all due respect, Governor, your way is failing. Are you gonna try to change anything to change this horrible statistic from what you're doing already?
Yeah, well, obviously in Mississippi, our legislature is a part-time legislature. Sometimes I wonder if in America, if our Congress was part-time, we wouldn't be in a better position. But let's talk a little bit about
better position than
Mississippi
what?
And where
Your
we
state
are with
is
the virus.
second worst in the world. I mean, how can you say that?
Let's talk about.
So that was CNN's Jake Tapper grilling the governor of Mississippi, Tate Reeves, obviously a Republican governor, who just has the most bizarre way to deflect from answering that, which after being presented with terrible evidence as to how his state is doing COVID-wise, then responds, well, we only work half time and maybe the government should also work half time. Like, what? Is that well, we don't have time to do all the things. By the way, we shouldn't do all the things. And it's good that there's death. Like what? Like it's good that we're second. If we were a country, we would be behind Peru or just in front of Peru. I want to go. Obviously, here's some the graph for the way Mississippi COVID cases are doing. It's something like almost 2,000 new COVID cases a day. But Mississippi is not, unlike other states, really well positioned to handle a health crisis like COVID-19. Few reminders, the state has fewer active physicians per capita than any other. 5 rural hospitals have closed in the past decade, which is something that has happened all over the country. And 35 more are at imminent risk of closing, according to an assessment from a nonprofit health care quality agency. There are 2,000 fewer nurses in Mississippi today than there were at the beginning of the year, according to the State Hospital Association. And can you blame those nurses for wanting to continue to work during a pandemic in a place where they're not feeling supported by their own governor, who is not taking seriously the amount of death and the amount of overworked hospitals and hospital workers? Tate Reeves, a little bit more on him and where he's been at and all this. So he's a first-term Republican who recently declined to call a special session of the legislature, a move supported by legislative leaders would hope to quickly allocate $1.8 billion in federal relief money to state health workers. So Mississippi's gotten preferential treatment. They've got money, they've got federal funds. I believe thanks to the American Families Plan, they've got this money to allocate, right? And he's not even able to do that. He's not able to call a meeting to in an orderly fashion, help these healthcare workers out and prevent them from, resigning en masse, as we know many of them have. He also, here's the thing that he and the Mississippi legislature have in common. They're both opposed to Medicaid expansion in that state, which we know, once again, there are, I believe about a dozen or more states, mostly red states, who have decided not to expand Medicaid, which helps disabled and poor Americans get access to affordable healthcare, free healthcare, which was stipulated under Obamacare, right? This is one of the things that Obamacare did well. But in the face of that, these Republican governors and legislatures are like, no, we don't want that free money. You can give us free money, we don't want that free money. We don't want to help the poor folks, we don't want to help the disabled in our state. Okay, but how is he done? Before I turn it over to Nelini, how is he done in terms of COVID? So a year ago, schools were going back into session and a second COVID-19 wave was growing. Reeves issued a statewide mask mandate saying masks were important, not only to protect oneself, but to avoid unknowingly harming our fellow Mississippians through asymptomatic community transmission of COVID-19, and is the quote, key to reducing transmission of the virus. That sounds pro-science. That sounds great. That sounds like he was taking care of his constituents. Well, something clearly happened. Was it the election? Was it Trump politicizing the hell out of COVID-19? But this year, he's saying a lot of different things. So this is still from Governor Reeves. The change in the CDC's mask guidance is foolish and harmful, and it reeks of political panic to appear they're in control. It has nothing to do with rational science. In Mississippi, we believe in freedom. So this is when the CDC was actually saying, you should still wear masks, right? And later, he, sorry, this is the last thing I'll say. He said, it was recently said nationally that the Delta variant was becoming a pandemic of the unvaccinated. Reeves posted to social media on Monday, quote, the most recent data from Mississippi suggests the same. Talk to your doctor, assess the risk, do the right thing for you, do the right thing for your family. So which is it? What are we doing here? We're all over the place. Is he trying to appeal to the MAGA folks and the Republicans and the Trumpers? Or is he trying to keep Mississippians alive? It seems like he wants it both ways. Nelini, your thoughts?
Yeah, I mean, I think that, Governor Reeves, just like many others, are just going with wherever the wind takes them. They're not actually thinking about science. They're not thinking about people in their communities. They're thinking about what is going to make me politically on the side of these folks who are really angry. And so when you see so many people who are saying, oh, there can't be mask mandates or vaccine mandates, he's just like fueling off of it. The other thing that I don't understand is, because I was actually talking to someone, I'm going to not name them, but they are in my family, who was like, I can't believe that federal workers need to be mandated vaccines. And I said, well, did you go to school? Because I had to take a booster shot. I had to take chickenpox after chickenpox finally got a vaccine because they didn't have it when I was a very, very little. I had chickenpox. I had to take like 15 different things just to enter elementary school.
Yeah.
And in the army, in the military, even though I am about demilitarization, they give you they just jab you with 20 vaccines or more because of all these things. But that is all okay. That is all okay. What's not okay is a vaccine and a mask for this current pandemic that we're in. And so it is completely illogical. And all of these governors just don't. I mean, the thing that I do have to say is that a lot of these states, because they've defunded so many of their infrastructure, don't actually have the infrastructure to release that relief. Mm-hmm. Like a lot of states, for instance, have been getting a lot of rental assistance, and they have not got the people to administer and distribute the rental assistance. Right. And so I think that it's going to be, I think the federal government has a really, really interesting pathway here. Either they step in and start to help out with relief and assistance and money and healthcare, even more so than they did in the past, or they allow these states to unfortunately kill more people, because that's what's happening at this moment in time.
Right, and it's like trying to, feed a giant beast some sort of like necessary medicine for its, continued development or whatever. I'm not someone think of a magical fantasy movie that works for, but it's like, because you can't be too heavy-handed on it. It's this dance of like, oh, we don't exist, we're the federal government, but like not really. And anyway, here's this assistance and money, and you might want to help out your own citizens so they don't die and they don't get evicted. Anyway, but who am I? Oh, I'm just a fairy. I'm a like you have
to fairy godmother that pops up.
Right? There should be a Republican fairy godmother that can slowly disperse and set up some sort of infrastructure for these red states where they don't have to ever, give Biden credit for it. In fact, we know they have been taking credit for a lot of the things that came out of the American Families Plan, and just not mentioning Democrats at all, or the fact that no Republican senator even voted for it.
Right.
Okay.
Exactly. They're like the American Rescue Plan. They're going all in their communities. Oh, you loved your child tax credit, right? Yeah, sure. Oh yeah, we did nothing. But they won't say that part. And that's what you're just seeing over and over again. And I just think that it is shocking to see the numbers and the polling of people who are actually frustrated about their governments. Now, what they do with that is going to be interesting, and we'll see this year and this fall and also in 2022. But people are really, really upset at these mostly Republican controlled state legislators or states that have their executives that are mostly Republican or all Republican, because people are just dying.
Yeah. And I know that a lot of healthcare plans are now not covering for COVID, right? And so it's only going to make the need for something like Medicare for all even more real and acute. And I hope that we can actually come to some sort of agreement, meaning massive, like sort of a cultural agreement and an understanding, even though we know the Medicare for all does poll very well.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.